The fourth wave is, as I say, starting to ease, but let's see what may be next for the Northwest Territories. Dr. Kandola joins us now. First of all, of the new cases you're seeing, how many of those people are fully vaccinated?
Roughly a third of our cases of COVID are fully vaccinated, and a third of our hospitalizations are fully vaccinated.
Were you surprised at all to see what appears to be waning immunity?
Well, I was watching what was happening in Israel and the UK, and I believe the US recently approved booster shots, initially with Pfizer vaccine, and then last week with the Moderna vaccine. I wasn't surprised specific to Northwest Territories because we were fortunate enough to get our vaccines early on, and we stuck to the tight schedule of 4 to 6 weeks. So we're pretty much about 8 months since our last second dose, especially for our high-risk populations. And what we're seeing right now appears to be waning immunity in those populations that were vaccinated first.
You know, the big question I think a lot of people in the southern parts of Canada are probably wondering about right now is, should we expect the same thing to happen here? In other words, kind of 8 months out of vaccinations, should we start seeing waning immunity and need a third shot?
I think every jurisdiction is looking at their own population and their data. What's in favor for most of the provinces is they vaccinated later, and they had an extended schedule between 6 to 12 weeks on average. So that would prolong their waning immunity. N.W.T was earlier, and we had a shorter schedule, and both those factors, similar to Israel, led to a lot quicker decrease in antibodies.
You mentioned that you had some snow where you are, and it melted, but obviously we're getting everywhere in Canada towards colder weather, more people spending more time inside. What do you think the next few weeks and months hold for the Northwest Territories in terms of COVID?
So we have reached the peak of active cases. We're still 9 times the national average, but for the communities that are experiencing community-wide spread, such as Yellowknife and Baychoco, which is a small Indigenous community now from here, that we've reached that peak and we're on the downward trajectory. I do feel, though, that if we provide that booster program, that we would be looking at a better winter than if we didn't have that available. Because in the north, we experienced winter a month earlier and a month later than the rest of Canada. And so more people are moving indoors, and it's really important that they're protected.
All right. Well, of course, we wish you well, Dr. Kandola. Thank you.
Thank you, Ian. Have a good evening.